Welcome back to episode 7 of the Dr. Beau Show. So today I just want to tell you a little story. So I took a drive. Well, I didn't take a drive. I went to Oak Mountain State Park, which is my local state park here. I say my, like I own it. Our local state park. Hit some golf balls, went for a little trail run. That was my Memorial Day break. And as I was driving back out of the park, I see a man running towards me on the road. And it's a heavyset man. He's kind of shuffling. It's running. It's jogging, whatever you want to call it. And as I get closer, I'm like, I recognize that guy. Well, it's a patient of mine. And it's not just any patient. So this patient was a guy that obviously a little bit overweight, had a lot of just wear and tear on his knees. I mean, when this guy bends his knees, it sounds like simultaneously popcorn being eaten, Rice Krispies having milk poured over them, tap dancing on bubble wrap, a lot of crepitus, very limited range of motion, both flexion and extension. Obviously there's pain. Still a very active guy. And he's out there running. Now, why is this so cool? Well, this guy, I had seen him 2 or 3 times just to kind of, get him up and running, get his knees working a little bit better. And what do I mean by that? He had basically been told that he was just destined for a knee replacement. But this guy was still doing CrossFit and all sorts of stuff. So he came to me and he's like, well, what can I do? And I go, well, just like you can floss your teeth and brush your teeth and work on them, degenerative change can be reversed. I know that's something that we sometimes in the medical realm think that it's just this, it's death sentence when you say you have, signs of wear and tear, degenerative change, osteoarthritis. A patient kind of gets this feeling that, especially when somebody from a place of authority, aka an orthopedic surgeon, tells them, hey, you're going to have a knee replacement. Well, now we're building this snowball or this magnet toward this idea of something that's already going to happen. And we're going to talk about that in a second of managing patient expectations. But when we're talking about making real change with something like osteoarthritis, it can absolutely happen. And if we think about the cellular biology and the mechanics here, all we have to do is think about Wolff's Law. So Wolff's Law says that bone in particular will adapt to the rigors or the challenges that it's put against. Wolff's Law basically says that when you challenge a bone or bony architecture, it will adapt to that challenge. So if I load my skeletal system with load-bearing things like weightlifting, jumping, sprinting, bounding, I'm gonna have a stronger skeletal structure. Well, when we get into joint mechanics, how I load the joint is going to determine the health of that joint. And this isn't getting into biomechanics specific, but if I don't take my joint, and in this case a knee, through its full range of motion periodically, I'm not bathing that joint in synovial fluid, which brings nutrition to things like the meniscus that are very avascular, but it's almost as if we're just like scraping the surface of this joint to maintain its integrity. But you also maintain a picture of that joint in your motor cortex, which means that you're going to call on that range of motion more often. So it's literally the adage, if you don't use it, you lose it. So if I can go through full flexion extension, but then we got to go up the ante a little bit. If I can load full flexion extension, now I'm going to get a knee that adapts. Now, if I've had years and maybe decades to stack up some nasty osteoarthritic change and condylation patella and all these things, and it sounds like a pack of black cats being let off on the 4th of July when I bend my knee. Well, it's going to take time. Good news is it takes around 2 years for bony architecture to change, right? That's the adaptation window when we start placing certain demands on bone. Now, does that mean it's going to be perfect? No. Does it mean it's ever going to be perfect? I don't know. But the body is an amazing thing if we allow ourselves to buy into science, not buy into necessarily beliefs. I think believing something can happen should be based on science, right? Like, hey, this makes sense. Now I've got my belief that this is going to happen. Really good book, Bruce Lipton, Biology of Belief. It talks about all this stuff, right? Epigenetics and what we can get done. But then the next part of this is how we manage patients and how we manage patient expectations. This guy had basically been written off to just let him get bad enough. And the most common thing that drives me nuts with people that are possibly going to have a joint replacement is a physician will say something like, a patient will ask the question of, well, how do I know when I'm gonna have this knee replacement, or when do I need this hip replacement? And the surgeon, the common thing is, oh, you'll know. So they're basically just saying you'll become so uncomfortable, be in so much pain, become so debilitated that you'll know it's time. Now, I've seen patients like that, and I've also seen patients that waited too long. And when they go get the hip replacement, which, interesting fact, the highest success rate of any orthopedic surgery is a full hip replacement. Pretty crazy if you think about it. But they waited too long, and after they got that hip replacement or knee replacement, they were so thankful they did because it changed their quality of life. So surgeries are great when necessary. But when we take somebody that's so far away from this imagined magnet of where the physician thinks they're going to go, and then tries to get this person to buy into it with, you'll know, right? It's coming. Like they have some crystal ball of degenerative change in the human body. It's a terrible expectation outcome match, right? We're telling them to expect the worst. We're not telling them to expect the best. Like, hey, put faith in your body, and here's the ways that you can go about this. And I think a lot of that comes down to the lack of knowledge in the orthopedic realm. And I'm not saying a blanket statement, but in general, that it's very mechanistic. It's very much they fix, right? It's broken, they fix, you're good to go. Well, science just is kind of turning everything on its head when we look at the fact that when you scope a knee, literally just poke into a knee and look around, your chance for meniscus tears and secondary surgeries and degenerative change goes up just from having your knee scoped, right? No surgery took place besides sticking a camera in there and looking around. So we need to be a little more careful about how we manage expectations, even outside of a surgeon's office. So when somebody steps into a conservative musculoskeletal practitioner's office, how are we talking to that patient? And a lot of people are wise to this now, right? There's whole lists of, hey, we don't say degenerative change, we say normal signs of aging. I also think we can go a little bit too far. We're talking to adults here. Adults, I believe, are warranted the truth of, hey, I'm talking to you because of this. Not that we're playing this psychological game. I don't ever tell somebody, hey, these are normal signs of aging. What I say is, hey, we used to call these degenerative changes. Now we call them normal signs of aging because they're normal signs of aging. Like, explain the process of how we got from this historical standpoint to where we are. And I think our job is to help people understand, not just coerce them with our motivational interviewing and psychological, interventions to try to get them where we want. That's not the goal, or at least it's not my goal for my patients. My goal for my patients is complete understanding. Almost to my level, and I know some people would say, well, that's why they're paying you. It's their body, right? Like, I'm not performing surgery, so I don't think necessarily that I'm equipped with a skill set that supersedes anybody. I may be able to do a few things to somebody that they can't do it themselves just because I am outside of them, but there's a lot of stuff that people can do for themselves. And that's why we always say we're educating and empowering. We're not just educating, we're not just treating. But like I said, it comes down to managing patients, but it's also this belief in the human body that, like, it can do amazing things. And I'm not trying to go woo-woo chiropractic that we're releasing innate. All I'm saying is science is, as much as we've, the scientific process has been around and looking at human physiology, biomechanics, anatomy, and all this stuff, there's still so much misunderstood and just not explored at all. So if you're in a scenario, you're in a therapeutic partnership, you're in some sort of relationship with your physician where you're hearing negative feedback all the time, even if it's not coming from a place where they're trying to be negative, but it's just not, there's nothing uplifting, nothing encouraging, nothing to look forward to, right? There's no sunset, even though it's a sunrise. There's no like sunset that's golden. It's just like, it's cloudy all the time. I highly encourage you to look for somebody else, to find somebody that's there to give you all the options, but also somebody that's there to tell you when that time has come, right? That, you'll know, maybe, but like, how people are in so much pain now. If we use that gauge of like, oh, you'll know when it's time, I don't think you'll ever, like, people just sacrifice themselves to surgery all the time, or they wait far too long and they start wrecking the kinematic chain. I mean, how many times, I can't tell you that I've seen somebody that needed a hip replacement and they've waited so long that now they have true, debilitating pain through their low back, or they've wrecked that knee of how they had to compensate around that movement. So you need somebody in your health life. And it's just, I've said this before, my financial advisor told me this, that his job is to become the objective kind of go-between between me and my money. That's what you need in your healthcare life, is somebody that's objective, that can tell you the truth in a way that's motivating and uplifting and also real when you need it, that's trying to direct you down the path rather than say, this is what we're doing, this is where you're headed. No, we're both headed here together, but there's like 15 options, and a lot of those options are based off of somebody being educated, somebody being empowered, and them making a logical and well thought out decision, which all that, is preceded with what we've just talked about. So a little bit different Dr. Beau show today. I hope you guys learned something. If you're working with patients, I hope that you're already doing this. If you're not, I hope you can take heed to some of this stuff. There's a lot of people out there that are way smarter than me that talk about, motivational interviewing, and Annie O'Connor with, talking about pain. And I mean, there's just so much stuff out there that we've learned in just the last decade. But there's also a lot of people out there that aren't looking out for the patient's best interest. And, I hate to burst their bubble, but times are changing, and the market's going to demand that those physicians change. So hope you guys learned something that makes you better than before, and I will see you next time.